Kenya is tonight heightening its surveillance of COVID-19 amid the growing spread of the new coronavirus strain first seen in the UK and South Africa. The UK has banned all arrivals from Tanzania and the Democratic Republic of Congo from Friday to stop the spread of the South Africa variant of COVID-19. This as 3 smart anti-epidemic robots were officially launched today and will be stationed at JKIA, Mbagathi and the Kenyatta National Hospitals. As Dorcas Wangira reports, 139 more people have tested positive for the virus.
As the world grapples with the spread of more infectious variants of COVID-19 from South Africa and the United Kingdom, Kenya is enhancing its monitoring and surveillance of COVID-19, particularly at major entry and exit points. According to the Acting Director General, Ministry of Health, Dr. Patrick Amoth, heightening overall surveillance is critical, especially because the spread of any new variant in the country could come from any of its entry points and shared borders.
COVID is here. There may be another COVID too, you never know. So we hope to improve our surveillance system through this, either the digital system or even better, the robotic system, if we are going to avoid these future pandemics entering the country.
Wednesday, 20th January, the Ministry of Health confirmed that 2 cases of the new coronavirus variant first seen in South Africa had been recorded in Kenya, and that the 2 men who are symptomatic have since left the country. Kenya, Botswana, Zambia and Gambia are the 4 African countries to record this variant, first identified in South Africa in December last year. So far, there is still no evidence of the UK variant in Kenya. However, given the widespread global transmission of this lineage, KEMRI has not ruled out a significant risk of its eventual introduction to Kenya. KEMRI is still studying 2 Kenyan SARS-CoV-2 mutations whose significance is yet to be fully understood. The United Kingdom has banned all arrivals from Tanzania and the Democratic Republic of Congo, DRC, from Friday to stop the spread of the South African variant of COVID-19. All passengers from these countries, except British and Irish nationals and third country nationals with residence rights, will be denied entry, as announced by Grant Shapps, the Transport Minister. The UK's rationale is in line with monitoring COVID-19 rates and new strains of the virus across the globe. The United Kingdom listed DRC among 21 African nations with a death rate above 3%. Africa's COVID-19 death rate now stands at 2.5%, higher than the global average of 2.2%. Tanzania has also downplayed the extent of COVID-19 in the country. Tanzanian authorities have not released any data on infections and deaths, with President John Magufuli declaring the country COVID-19 free in June 2020. Meanwhile, Kenya is set to benefit from anti-epidemic robots officially launched in Nairobi. The 3 smart anti-epidemic robots are part of a partnership between the Ministry of Health, UNDP, and with funding from the Japanese government at the cost of 240 million Kenyan shillings. The robots, Shujaa, Jasiri and Tumaini, will be stationed at JKIA, the Mbagathi Hospital and the Kenyatta National Hospital. They are intended to reduce contact between high potential suspected people who are infected and health workers. With both wide angle and long reach, the robotics can measure the temperature of 10 to 100 persons per minute at a distance of 2.5 to 3.5 meters, an innovation already in use in Rwanda.
I have every confidence that our travelers, foremost those tourists visiting Kenya, will appreciate the ability of these robots to fast-track traveler clearance at airports. Robots will never replace people. Let's get this thing straight.
In the last 24 hours, 139 people have tested positive for COVID-19 out of a sample size of 5,487, bringing the confirmed cases to 99,769. 1 patient has died, bringing the fatalities to 1,740. 137 patients have recovered and 577 are still admitted in various hospitals. Dorcas Wangira, Citizen TV, Nairobi.